Welcome back to Teaching 2. My name is Jay, and today I'll be going over 3 pieces of information. 1. What is virtually observed therapy? 2. How is it different from directly observed therapy? And 3. Areas in healthcare where it is being applied. Now, the term itself sounds very self-explanatory, but it is definitely important to explain. Virtually observed therapy, or VOT, is the use of digital technologies to determine if a patient has taken their medication orally. Now, I want to distinguish this term from directly observed therapy, or DOT, which may be familiar for many healthcare workers, because I think it is important to note the added benefits that virtually observed therapy can have. Historically, we have seen DOT in patients with tuberculosis or in a psychiatric health setting where the patient's healthcare team watched the patient take their meds in real time. Now, while this helps ensure that the patient is adherent to their drug regimen inside the clinic, which is still crucial in maximizing positive patient outcomes, it does come with some obvious limitations and challenges. For instance, a patient can easily save and/or dispose of their medication for later through tactics like parking or cheeking a pill, and it can be difficult to detect in the moment from an observer's eye. Additionally, directly observing a patient taking their meds outside of a clinical setting without some sort of digital component is tough. With direct observed therapy, also, we can see how possible healthcare resources are being diverted from quality care management for this mundane task. But this is exactly where VOT and that digital component can have an impact and more. Companies like AI Cure are using artificial intelligence to capture when patients take their medications to completion, meaning it can identify if the patient actually swallows the pill and eliminates the need for a careful care team review. This technology is currently used in clinical trials and in certain therapeutic areas like infectious disease and anticoagulation therapy right now. Emoca Health also focuses on medication adherence, but makes it easy through a remote adherence monitoring smartphone app for patients to then upload videos of pill intake for asynchronous clinician review. This just overall increases a healthcare team's workflow efficiency by allowing for better use of team resources. Now, both these companies have interesting clinical studies, and I link them below. As always, thank you all for listening, and if you have any questions or thoughts, please comment below and be sure to subscribe to our channel to hear about future videos.